it. Okay, let me delete that. Okay, and we are broadcasting, but I can edit the beginning. So I'm not going to introduce you, because what I'm hoping to do is for this to sit alone as your own little video.
Let's talk about weight loss for summer ahead. Now, my experience in the last 15 years has put all my ducks in a row so that I can present to you today something that I feel is workable and that will cover approximately 80% of the population. It is still very important that you must realize that each and every patient is an individual. So what I've put together today will honestly cover 80% of our weight loss patients. So if I can just map our discussion, I'm going to cover 5 areas today. First of all, we're going to talk about the weight classification. Then we'll talk about the different diets that's available. We're going to talk about the Cape diet. We're going to talk about the Barcelona diet. We're going to talk about IgG, food intolerance diet. And then we'll end off the discussion by giving you the benefits, why it is beneficial to lose weight. If we start with weight classification, first of all,
James, sorry.
Yeah.
If I put a smiley face in there, please just note that I'm trying to communicate with you, okay? Because I don't want to interrupt you when you're on a roll. Just some comments. Try and look at your webcam more than anything else, because you want to pretend you're looking directly at people, not. Sorry, where's my video cam? You don't want to be looking like there and then there. You want to look directly at your webcam. If you need to look at your notes, it's fine. That's fine. But just try and, because you're obviously trying to speak directly to a person. Hello and welcome to James's weight loss, or hi there. Today I'm going to be talking about weight loss, you know, for your body, for your health. So just be, you know, open and relaxing and hi. Like I'm a customer right now. Think of me as that customer that you need to make that impression to in a normal world. Okay, cool. Let's go for it.
You want to start all over again?
Well, you can. I think I can work with that, but you're looking at the camera, which does concern me, because I'm looking now at your eye contact in.
Okay, let's start again. No problem.
Bit of a smile, relax, like you're talking to me, and you know. Okay, wait.
All right, let's talk about weight loss for the summer ahead. I know a lot of you are ready for summer and would like to look good for yourself and for others. And let me share you my experience in the last 15 years helping people to lose weight. So the programs that I've put together will cover the needs of approximately 80% of potential patients. But please remember, you are still very much an individual, and keep that in mind. We will cover 5 areas today in this discussion. The first area is weight classification. The second area is the Cape diet, then the Barcelona diet. Then we're going to talk about the IgG, food intolerance diet, and we'll end off with why it is so beneficial to lose weight. Let's look at weight classification. People with a body mass index of less than 18.5, we classify as underweight, and obviously they must not lose weight because it will be detrimental to their health. Then a normal weight to have a body mass index of 18.5 to about 25, that is a normal person. You are overweight if you have a body mass index of between 25 and 30, and you are classified as overweight when your body mass index is between like 30 and 40, and then you are severely obese if your body mass index is higher than 40. The first diet that I put together for you is the Barcelona diet, which is a low-carb diet. It is grain-free. It is a balanced fat and protein diet, and it is for your... Romany, can we rewind this, please?
Yes. This is what I want to just say and interrupt. What you can do, and this is what I'm going to suggest to you. You can go, because what I find with recording is that sometimes we'll go on a roll and then we lose track or we lose sentences. So what you can do is just pause, okay? Don't speak immediately, because when I'm editing, If you're speaking too quickly and over your words, then I find I can't edit, because then it's too close together. So if you want to start again, all you have to do is just pause, start again, and then go on. If you feel like you need to pause, just pause again, because I can edit that and move it around and do whatever. So feel comfortable about what you're doing. If you're not happy with what you said, just pause, start again.
Okay, so I started with talking about the Barcelona diet, but I wanted to start with the Cape diet.
Okay, well, start with the
After the weight classification, this is the next thing that must be discussed.
Okay, but
Right,
why?
so we're going to talk.
Why your weight loss program?
I have experienced with people that want to lose weight for the last 15 years. And for me, it was also a school to learn about different needs, different diseases, different requirements, different health stats. And that has given me the ability to put different programs together for different kinds of weight loss patients. So what I've put together today will cover approximately 80% of people out there that want to lose weight. But please remember that each and every one of us is still an individual. And if you don't lose weight on any of these programs that I've shared with you today, you need medical attention. The first diet that I want to discuss with you is the Cape diet. And that's normally an entry-level diet. So people that don't have a lot of weight to lose can start here. People that are very young and want to lose weight can start here, because when you are young, you normally have a very fast metabolism, and a more liberal eating plan will assist you to lose weight. So why the Cape diet? The Cape diet is wheat-free. It is the entry-level diet, as I said, and it's just basically for your overweight patient. And that will help them to lose a few kilos to get into their bikinis or just to get ready for the summer. The next diet is what is the more popular diet in the clinic, and that is the Barcelona diet. And that is really where you have your obese patient. In other words, that is a patient with a body mass index between 30 to 40. It is a grain-free diet, a low-carb diet. It's balanced fat and protein, and it is really for the obese to the severe obese patients. The last diet is the IgG food intolerance diet. It is very individualistic. We do specific tests on specific food groups for patients with blood. So when you've tried many diets and you really and truly cannot lose weight, and you really want to lose weight, you have to go for the IgG diet. And that's where you have two options. You can test 90 foods, or you can test 271 foods with your blood and see how your blood reacts with the different kinds of food. The problem is when you are intolerant to certain foods, the foods cause inflammation in the body, and inflammation causes water retention. Last but not least, I would like to discuss the benefits of losing weight. Now, if you just lose 10% of your current weight, you reduce your risk for chronic diseases with 50%. And then we talk about diabetes, cardiovascular disease, lower energy levels. Where in the world can you invest 10% and you get a 50% return on investment? So the body is actually very forgiving. And if you only lose 10% of your current weight, you get like a 50% benefit. And that is really something to look at. Other benefits, remember, you reduce your risk for chronic diseases, you have more energy, you get noticed, your sex life will improve. Isn't that magnificent? And you have a positive influence around you. And then last but not least, you will have more money for fun, for recreation, for traveling. And you have to spend less money on medicine. So for all of you out there that wants to lose weight, this summer. I wish you well, and please try our programs. They are trialed for many years in my clinic, and I know they work. And if you cannot lose weight with these programs, then you need to see a healthcare professional to suss out what the problems are so that you also can be successful and lose weight. Thank you.
I'm thinking.
I hear.
Okay, I will see what I can do with that. I'm just weight loss. Why the chronic? Okay, so if I had to ask you the question in terms of, okay, so I'm obese and but how do you know that I'm going to get a chronic disease from being obese?
You basically have to go for a medical checkup.
No, but what I'm saying to you is, you said earlier that the benefits of losing weight is based on the fact that you can lose, if you just lose 10% of your body weight, you prevent chronic disease by 50%.
Yeah, the thing is, Romany, when you're really busy with these seriously obese people and they start to lose weight, they, first of all, you have to reduce their blood pressure medication. Then eventually you have to start reducing their medication for diabetes. And if they've lost sufficient weight, some of them are off all these rubbish drugs.
Okay, but this is what I'm asking you, because what I'm saying to you is, you see, I'm looking at it from a perspective of, okay, I'm a little bit overweight at the moment. Let's say I'm a little bit overweight and I'm still eating a lot and I'm very unhappy with my life and I'm very depressed. I'm not caring about chronic disease at this stage. So you saying if you have a body index, and that's how you need to present it. If you have a body index, and you need to remind them of that. If you have a body, because now you spoke about it earlier, but by then I've forgotten already. So when it comes to the benefits of losing weight, if you've got a body index of X and over, you need to seriously consider your health or your weight or your whatever. Because what you need.
I think let's make it clear there. So the thing is, if you have a body mass index of more than 30, you are classified as obese and you immediately in a high risk category for chronic diseases, diabetes, cardiovascular disease, arthritis, and other diseases. So,
and how much does that increase by? Because you see, if I'm a little bit obese, okay, I'm a body index of over 30, I'm chronic disease, I'm afraid of chronic disease. So maybe, I think what you could do is, yes, you could say something like, if you have a body index of over 30, you need to consider your weight because it can cause health, chronic diseases. But what I would suggest is, you see, you can mention diabetes, cardiovascular disease, which you need to mention, but I think you need to mention some of the symptoms, because symptoms speak louder. In other words, you want to, if you are at the body index of 30, you want to start considering, because you're going to do chronic disease, you're going to start feeling your blood pressure is going to get higher. That means you're going to start feeling tired, or you're going to start having these kind of symptoms, etc. Or did you see what I'm saying? So that people can start relating to the symptoms of how it's going to impact their lives. Yes, you're going to take medication, but it's going to, you're going to walk slower. You're going to have to get up at night 3 times. And okay, I think you got it.
Are we on air again?
Yes.
Fantastic. So let's talk about the benefits of losing weight. If you are obese, if you are classified as obese and your body mass index is between 30 and 40, and for those that are severely obese, it will be more than 40. Obese patients are high-risk patients for chronic diseases. If you lose 10% of your current weight when you are classified as obese, you reduce your risk for chronic diseases with 50%. And then we talk about cardiovascular disease, diabetes, arthritis, and so on. what are the common symptoms around these chronic diseases? You feel tired, you don't have energy, you don't sleep well, you have blood sugars that spike and you feel dizzy, you get sick frequently, your joints start to ache, you have headaches because of high blood pressure. So there are a lot of symptoms that are commonly associated with people that are obese and really need to lose weight. So please, for you out there that needs to lose weight, that are obese, get in there and get your benefits. If you lose 10% of your weight, you get a 50% return on your investment and feeling better and reducing those risks. Then also you have more energy. You get noticed. You have a better sex life. Wow, isn't that fantastic? And of course, you have a positive influence on people around you. If people see you feel better and you look better and you're more energetic, it will rub off on them too. And then last but not least, you will have more fun, you will have more money to spend on yourself, on vacations, on fun things, because you have to spend less money on medication. So for all of you out there that wants to lose weight this summer, I wish you a fantastic summer and happy losing weight. Thank you.
Okay, I think we can do something with that. I'll give it a bash and see how we go.
Well, you see, I joined Toastmasters, as you have seen and might have known, and they will teach me more skills to perform better on social media and television and radio and whatever. It's a process.
Oh, are they teaching radio and television? Because they'd only, well, they only used to do speaking.
The thing is, Romany, in time to come, these newsletters that I write, I think it's going to become a waste of money because people want like a 2-minute or a 3-minute YouTube clip where you quickly speak about depression and cholesterol and diabetes and high blood pressure and all of that.
I agree with you.
People don't have time to read pages and pages of shit anymore.
No, I know. That's why I was looking at one of your blog posts that I was going to use, and it was so long. I thought, oh my gosh, I'm going to let's skip that one. But there is something I need to ask you because I've got here my 10 favorite vitamins, minerals. When I turned 40, it seemed to me like I had put on weight by looking at food. And I've changed that wording. I changed it to that. As we age, our bodies change, and so does our metabolism. Okay, no, I'm happy with that. I'm fine with that. We'll use that. Adiposity. Decrease insulin resistance and reduce
adiposity.
How do you spell it? Is it ADIPOSITI?
Adiposity. It says adipose fat is the fat that accumulates around the belly.
Okay, but I just want to make sure it's spelled correctly.
Adiposity.
Adiposity. Okay, all right. Because it's coming up as spelling error, but I also know that
adipose. So just try adipose. Adipose fat.
Adipose does come in as a word, as a spelling option.
I'd rather use adipose.
Okay.
Romany,
yes.
I'm going to the CBC meeting this coming Friday.
Right.
At Century City. Would it be possible to have the little YouTube clip ready and those other diets on Everletic?
Well, okay, so this is what I need to chat to you about. I'm not sure when I'm going to have the video ready because video editing can take time.
Can we have the Everletic stuff ready?
I've done the 2 diets and I've set up the forms for them, but I'm going to need someone because Everletic has changed so much. You know, I'm a coder. I don't work in fancy drop and drag. It confuses my brain too much. And when I looked at Everletic yesterday, they've changed so much about it that I don't know how to just go and say, for me, I work in code and I copy and paste and I'm done. So if I send you info, can you get your girl to upload it to the autoresponder? Are you on that part as well?
The thing is, I I honestly and truly don't know whether Fran can do it. But I mean, if you can give little instructions and then she can try.
Oh, who's sending out your newsletters then?
Fran.
Well, then she should be able to know how to do it, you see, because she's, you know, they will learn from a style design, no coding, you know, so it's a different mindset. Whereas now I'm looking at all the options, and if they can just give me an option to go copy and paste code, I'm done. But now they first want me to go this way and that way and follow this, and it's confusing me for right now. I can send them a help request. Let's see, Everlytic. Is that your password? Okay. And I should have that ready. In terms of your paid diet, as I said, somebody's not going to stay. Fast pay, they only take payments up to 5,000.
But remember, we discussed that already. We said that we're not going to create a pay page for it. It's going to all happen at the clinic.
So must I just put in a standard information form, or do you want to take some form of deposit? It's going to make it more complicated.
No.
So they just pay at the clinic once.
All payment is going to happen via the clinic.
Okay. Okay.
If they want to pay, then just contact us directly, and we will email them the bank details, and they can deposit the money directly into the bank account.
Yeah, which I doubt anyone will really do.
I personally feel that kind of option is going to be something that I sell here in my office.
Well, that's what I think too, because it's so expensive.
But I want, you know, people must come to me and say, you know what, I saw the IgG diet thing on your website. Can we talk about it?
Yes.
And then I explain to them, okay, I'm going to take it, or I cannot afford it, or whatever.
Okay. Yeah,
so
no,
I think
to me,
that's my opinion.
Okay. All right.
And then just please, we have to update the book.
Yes, I'm going to do that this afternoon. I'm not going to use PayPal for now.
No, we stick to pay fast.
Because they've got a shipping option in PayPal, but I'm not sure they've got a shipping option in
Pay fast.
Yeah, but that's fine. I'll just include it in the cost.
Yeah, just include it.
I'll put in brackets and do what I need to do.
Whether in South Africa, it's one price, and whether if they're outside South Africa, it's another price.
I saw that, yeah. I saw that, yeah. I'm going to try and finish that all today. I close that browser now. Because I've done a lot of it. It was just the final bits. And that Everlytic that I have to now go and learn as a what do you call it? Layman. Yeah, no, but I'm saying I'm going to have to go and try and learn it as a layman rather than a coder. I'm not sure. Tech things work with me, but simple things don't always. Anyway, James, so that's fine. We can stop.